Vomiting on Ozempic or Mounjaro can be common early on. It can also become dangerous much faster than many people sometimes expect. One rough episode after a dose increase may fit the normal adjustment pattern. Repeated vomiting, trouble keeping fluids down, or severe belly pain can mean the problem is no longer routine, and that distinction matters most. Most people do not need to panic after one bad day. These drugs slow how fast the stomach empties, so a meal that looked ordinary before can suddenly feel excessive. That is why vomiting often shows up early, after a dose increase or after a heavy meal. Vomiting alone does not tell you whether the episode is still expected or starting to turn unsafe. Some people treat every vomiting episode like an emergency. Others brush off every episode as normal because these drugs are known for stomach side effects. Both mistakes come from missing the pattern. The pattern tells you whether your body is still adapting or whether it is starting to lose too much fluid to stay safe. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Ozempic, Semaglutide, and Mounjaro, Tirzepatide, can both cause nausea and vomiting. That is built into how these drugs work. They reduce appetite and slow stomach emptying, which means food stays in the stomach longer. If you eat too fast, eat too much, or move up the dose before your body settles, vomiting becomes more likely. That does not mean the drug is failing you. It also does not mean the drug is working better. Vomiting is usually a tolerance signal. Your stomach is saying the total load is too high right now. That load can come from the medication, the meal size, the meal type, or the speed of dose escalation. A more routine pattern usually has a clear trigger and then starts calming down. You began recently or just increased the dose. You ate a large or fatty meal. You vomited once or twice. Then you could still sip fluids, rest, and gradually feel more stable over the next several hours. A more dangerous pattern behaves differently. Vomiting keeps repeating through the day, and water comes back up. Your mouth gets dry, you feel dizzy when you stand, and urine becomes dark or much less frequent. At that point, the main problem is no longer only the stomach. The main problem is fluid loss, and fluid loss is where kidney stress can begin. That is why the drug warning tells patients that severe vomiting can lead to dehydration and sudden kidney problems. It also tells patients to report persistent or extended nausea, vomiting, and diarrhea. This is the line between a rough side effect and a safety problem. Once vomiting keeps going, the risk is no longer only discomfort. That warning matters because repeated vomiting is often misread as proof that the medication is finally working hard. That is not a success sign. It can mean the dose is too aggressive for you right now. It can also hide a more serious problem, because people often explain away symptoms once they expect side effects to happen. One of those more serious problems is pancreatitis, which means inflammation of the pancreas. Official medication guides tell patients to get medical help for severe stomach pain that does not go away. That matters even more if the pain reaches through to the back or comes with repeated vomiting. That pattern should not be framed as routine adjustment. Another hidden problem is a gallbladder issue, such as inflammation or a gallstone blocking bile flow. Fast weight loss can raise that risk, and vomiting does not rule it out. Vomiting plus steady upper abdominal pain is more concerning than vomiting alone. Add fever, yellowing of the eyes, or pale stools, and the picture has clearly moved away from a simple upset stomach. Not every dangerous pattern comes from pain. Low intake can become its own problem too, even without dramatic pain. Some people are not only vomiting, they are also barely eating, and that combination can make them weak, shaky, lightheaded, or mentally foggy. This gets more complicated in people using insulin or sulfonylureas. Those are diabetes drugs that can lower blood sugar. Even when the bigger problem is low intake, fluid loss can still build slowly and become dangerous. The episode does not have to look dramatic to be unsafe. A person can lose fluid slowly, drink less than they think, and still look fairly normal for hours. That is one reason people misread dehydration early and wait too long. That is why you should not focus only on how many times you vomited. Focus on whether your body is still functioning normally. Ask four things. Can you keep small sips down? Are you making urine? Can you stand safely? And are you thinking clearly? Those answers tell you more than the word side effect does. Dangerous vomiting is often quiet at first. It starts as repeated nausea, small fluid losses, less drinking, and a bit less urine. Then the person gets weaker and dizzier and says they are probably fine because the drug is known to cause stomach side effects. That false reassurance is where trouble grows. Some people can become dehydrated faster than others. That includes older adults, people with kidney disease, people on diuretics, and people who already drink very little. In those groups, the same vomiting pattern can become dangerous sooner. Risk is not only about the drug, it is also about the body receiving it. If the pattern still looks mild, keep the response simple. Higher risk groups should call earlier for the same level of vomiting or trouble keeping fluids down. Pause large meals for the moment. Avoid greasy food. Take small sips, not big gulps, then restart with small amounts of bland food once the stomach settles. That gives the stomach a lower load to handle. Time helps separate a routine episode from a dangerous one. A rough but routine episode often eases over several hours. A dangerous episode keeps resetting every time you try to drink. If the day is moving forward and the vomiting is not, the meaning of the symptom has changed. That is the point where caution should rise, not drop. If vomiting keeps getting worse instead of easing, escalate early. Repeated vomiting with trouble keeping fluids down needs medical advice promptly. Severe abdominal pain, fainting, confusion, chest pain, or vomiting that keeps building can justify urgent care or emergency evaluation. It is safer to overreact once than to normalize the wrong episode for half a day. If vomiting clearly flared after a dose increase, the answer is not always more discipline. Sometimes the safer move is a slower titration, a temporary hold, or a discussion about whether the current dose is simply too much. People often blame themselves when the real issue is pace, not effort. Prevention starts with smaller meals and slower eating. Be cautious with very fatty meals and alcohol. Pay extra attention during the first weeks and after each dose increase, because that is when stomach symptoms commonly peak. Prevention works best before the stomach starts fighting every bite. The bottom line is simple. Vomiting on Ozempic or Mounjaro can be normal when it is short-lived, clearly triggered, and still allows fluids to stay down. It becomes dangerous when it keeps going, blocks hydration, causes dizziness or low urine, or comes with severe abdominal pain. Expected does not always mean safe. Pattern matters more than panic. Medicine, simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.